we have around 6,000 cases in the United States and abroad, like America, Canada, and Europe. They have no one recorded case of rejection. So we have a drug, natural, that can be used without causing harm if it does not cause good. So what we did, that's a unique drug because it's natural drug. And the stem cells have the power of regeneration, rebuilding, reconstruction. People use genes, but the genes, all the genes are in one stem cells. All the genes that formulate any organ in your body are there. And the beauty of these stem cells is so smart that it has a gene and it gives it where it is needed at the time is needed. So in cases of the people they are sick, they don't have enough stem cells to do that for one reason or the other. Okay? So at these circumstances, if we give them young, energetic, reconstructive stem cells, they do the job. How they do the job, I've been asked. It's very simple. You have in your home a smoke detector engine that detects the smoke and convey it to the station where the fire engine will be sent to you. Even if you are not there, it will be sent to you. And the same thing happens in the body. When you have a sick organ, it will be hypoxic. What is the meaning of hypoxic? It lacks oxygen. Lack oxygen it secretes a lot of growth factors and chemotactic material that circulate in the blood and reach the organ where the stem cells are stored. And it attracts the stem cells. Those are the fire engines that come to the center of the fire where the lack of oxygen and start treating. How they know? They break the window, they open everywhere, but they get inside the house, they stop the fire. And that's what the stem cell does. If you don't have enough stem cells, we supply you with stem cells from outside. That's the theory, and it works. We had 4,000 patients treated with umbilical cord stem cells. We don't have one major rejection. Our side effect is a little bit of fever, a little bit of headache. They go away in a few days. So this is, we have a medicine that's not rejected, it works. How it works? It goes and supply the organ with the material needed. You are lacking of gene, you don't see. Maybe it supply the genes. How it works, we don't know. But we know it works. Because now here, you can talk to each other and see, since July 07, we didn't have one ONH. Now we have around 47. Some of them here in front of you, some of them are learning how to drive. You talk to it, you make your judgment. One side, you said it's not enough. Sure, it's not enough, which you are completely normal. But if you haven't seen before, it means 90% of perception of life around you is gone. If I give you 10%, you are in a better shape. If I give you 20%, you are really very rich. If I give you 40%, you are in heaven. This does not mean anything to the guy who is judging you from his ivory tower. But you don't live in an ivory tower when you have a child who does not see. But that's true in all other diseases. We don't treat this disease only. We have a variety of disease. And if anybody wants to find out what disease we treat, I brought my computer here. You can come and talk to me about it. So that's what we are offering you. I don't want to take all your time. I'd like to leave the things as it is. I'm open to answer any question you have. I have to say something very important. People like Carol is the community people, is the people that God sent to help you out. She helps you at every level. She gives you her own experience, okay? She gives you how the way she did it so you can do it. Not everyone has money to go, but she helps you with that. And she helps people coming from there to tell them you are not going to be perfect. If you are going to be perfect, don't go. Expectation will destroy your life, or you build your life. I stop at this level, and I will be available to all of you to answer any question. Thank you very much, and thank you, Carol.